Dr. Caldwell, and I will be discussing professional conduct. So, with professional conduct, you want to know that once you brand yourself as an office, everywhere you go, you're basically bearing your image. So, in your office, of course, you want to have professional conduct with your patients. You want to make sure that your interaction with them, obviously, is one that is caring and wholesome. But there are certain lines and boundaries that you have to maintain with a patient doctor relationship. Inappropriate comments are something that cannot be made in the office versus and also just making sure that there isn't any behavior that happens between you and a patient that could be misconstrued for something else later on down the line. So you want to make sure, as far as a professional, with dealing with someone in the office, always make sure there's someone like a CA there to witness all interactions that happen between you and a patient. If, for instance, something bad happens down the line, where there's a miscommunication of something that was happening between the patient and the doctor. Also, outside of the office, you bear your brand's image. So you have to be aware of your conduct outside of the office as well. Not saying that you have to constantly be in this doctor mode, but you have to be aware of how you interact with patients and how that can affect your reputation within the community. So there are certain lines that you have to draw as far as when you're giving advice about care. If you are a doctor and you happen to be out at a party and you've had a few drinks, obviously you want to make sure that you're not getting drunk and especially too drunk and under the influence where you cannot be driving. But also, you want to make sure that during this time you are not offering any professional advice to any patients or anyone who could be a hypothetical patient or just someone who wants to know about chiropractic care. You have to be very careful to make sure, hey, this is not a great time, but here's my card. Come into the office. If there's anything that you're experiencing that feels like an emergency, please go to the hospital because you never want to say, hey, just wait to come into my office and it was an emergency. And then something bad happens to that person and you become responsible because you offered the advice for them to wait. So you have to be very careful with our patient interactions, both inside and outside of the office.